Hello, it's my pleasure and delight to have you join us on this week's edition of the program Healthcare. It's Rebecca Jott, and Healthcare is coming to you live from the Plateau Radio Television Corporation here in Jos. And you know I'm always excited once this opportunity presents itself because I want a healthy viewer. I want people that are very healthy, people that have people that are educated, people that don't joke when it comes to do with their own health. So that is my joy always. And so today on the program, like we've always come with issues to talk to you, we'll be looking at the issue of blood donation. And I'm sure that you must have heard about blood donation. You might have been, transfused with blood. You might have donated for someone and all the likes. So we will try to find out what is blood donation all about, who is eligible to donate, are there some side effects, okay, what do we require in terms of blood donation. So that is the focus today, and I have with me in the studio by my right Dr. AYUBA NAMANG JEHU. He is a resident doctor, Department of Anatomic Pathology and Forensic Medicine with the Jos University Teaching Hospital, and he's also the Public Relations Officer, Nigeria Medical Association, Plateau State. You're welcome.
Thank you for having me. Good afternoon, our viewers.
Yes. And by my left, I have a Dr. GIWA Moses Simon. He is a registrar, Department of Anatomic Pathology and Forensic Medicine, Jos University Teaching Hospital. Doctor, you're welcome.
Thank you very much. Thanks for having me.
Yes. So with the two of them right in the studio, you know that we are good to go. So blood. What is blood?
Okay, thank you. Sorry, suffice it or permit me to a bit take some time to greet our viewers on behalf of the Nigerian Medical Association, Plateau State Branch. I bring you greetings from my chairman and all members of NMA Plateau. I also want to, on behalf of NMA, pay our condolences to the families of those who died in the recent attack in Mushere, in Boko's local government and some other parts of the state. It's unfortunate, and may God continue to comfort the families of those who have been affected by this. And for those who have sustained varying degrees of injuries, we pray that divine healings will come their way. Of course, it is important that we're talking about this topic now because we are aware that many of them at one point or the other were victims that needed blood transfusion. And of course, blood transfusion is a life-saving procedure for mankind, humanity. And this topic came in very timely because about a week and some days ago, the International or the World Blood Donor Day was commemorated on June 14th. Usually it is celebrated annually to commemorate the birth of somebody in the scientific world known as Carl Landsteiner. This was the man who first was able to classify blood groups into A, B, and O. So his birthday was June 14th, and that was why the day was designated as Blood Donor Day.
Okay.
And through the years, there have been themes and topics of discussion that used to come around. And this year, the topic of discussion was one drop of humanity, give blood, save lives. Okay, so it is important that we're here now because at every given point in time, somebody would need blood. As we're talking with you right now, I'm sure somebody somewhere is either receiving blood, somebody somewhere is losing blood, somebody somewhere is being is probably there's a need to get blood for him or her. So blood is very important. This topic is very important, and I believe that at the end we'll be able to help the public as to how and what we should do in order to promote blood transfusion services. Now, blood, the question is, what is blood? Blood is the component of the body that has so many functions. Okay, first, starting with transport. It transports oxygen around the body. When you breathe in air, the air goes into the lungs and then it is exchanged, and it enters into circulation. Okay, and then it goes around, and the cells of the body are able to breathe, so to say. Okay, apart from transport, even nutrition, even defense. From basic biology, you would have known that blood has major components. Three. Okay, we say red blood cells, we say white blood cells, we have the platelets. Okay, then the fourth component, which is not cellular, is what we call the liquid form of blood, which is plasma. The plasma can further be divided into two. We have serum and fibrinogen. Okay, so you can see that blood as a whole is a very rich mixture, okay, that circulates around the body and is essential for the well-being and the survival of a human being. All humans have blood. All humans need blood. All humans must use blood.
No.
Otherwise, we cannot stay alive.
Okay. No wonder it is said blood is life.
Blood is life.
Okay. Thank you. Okay, Dr. GIWA. Now this blood that is life, that has a lot of functions, it does a lot of things. What are the different types of the blood groups that we have?
Well, thank you very much. We classify blood groups based on the ABO system and then the rhesus factor. Now, the ABO system, it's either A, B, depending on the antigen or antibody present. Now, when a person is said to be blood group A, it means he has the A antigen, right? And then when he is said to be blood group B, it means he has the B antigen, which means that he has the opposing antibody. Antigens and antibodies act against themselves. And of course, God will not permit you to have things that are conflicting each other, right? So when a person is said to be AB, it means he has both the A antigen and the B antigen, and that is why they have both antigens. And then when a person is said to be O, blood group O, it means he has he doesn't have both A and B antigens. So in that case, he just have the antibodies, which are the A and B antibodies.
Okay.
Right. Then for the rhesus classification, we said we classify them as either being rhesus positive or rhesus negative, depending on the presence of the rhesus factor. Now that is why when you combine them, you will hear that people have AB positive blood.
Okay. Now
A is the ABO component. Then the positive or negative is now the rhesus component.
Okay.
I think when you know that, because when you do blood transfusion, you have to put all of that into consideration.
Yeah. Okay. So this ABO, is it hereditary or just like that?
Yes, it is hereditary. Most of the time, it is we inherit it from our parents.
Okay.
Yes.
Okay. Thank you. So now we're talking about blood donation here. So when we say blood donation, what does it mean?
Okay. The same way we talk about free will donation, that's what it means. Maybe I should say it that way in layman term. Because usually, when we say free will donation, it has to do with giving, right? Somebody gives to another person who is in need.
Yes.
Okay, of that thing. The same concept applies to blood transfusion and blood donation. In blood donation, there is somebody who is giving. Okay, he has the blood and he has sufficient amount in his body that is enough for him to carry out basic functions of life and even to spare some. Whereas alternatively, on the other hand, we have somebody who needs it. Okay, who has maybe the blood amount in deficit. He has a deficit. He or she has a deficit that needs to be, supplemented. Now, this person now would require somebody to donate. Okay, and that's why we have the concept of donor and a recipient.
Okay.
We have blood recipient and then we have blood donors. Now, blood donors are people who give blood, okay, for the purpose of others who are in need of blood. And of course, there would be reasons why a person would need blood. Okay, I think that's not a topic for us to be discussing now, because it's another ball game all on its own. Maybe another time when we get the time, we can come and talk about it. But then, a blood donation simply means the process by which blood is taken from one individual, preserved, and then given to another individual. Okay, for the purpose of saving lives and curing diseases. Okay, now I suffice it to say that maybe there are criteria for blood donation. I don't know if I should go ahead and just talk about them. Okay. Now, usually, it is good that one can donate blood to the other. Okay, but it is also good that the person who is donating has enough. Okay, let you not be that you are so sacrificial and you give out your blood and then you die in the process. Okay, and that's why there is a criteria that people must fulfill in order for them to donate blood. Okay, first of all, these people must be healthy themselves. Okay, and then what do we talk about when we talk about healthy? What do we talk about? This age we're looking at. Okay, anybody who will donate blood to another person must be between at least 16, some say 15 to 65 years of age. Okay, it is believed that somebody who is below 16 is not fit to donate blood to another person. It is also believed that somebody who is 65 or above 65 is not fit to donate blood to another person. Okay, now another thing is that the person's PCV must be taken. That's the
What
blood,
is PCV?
The blood count, packed cell volume. That is what it means. Packed cell volume. They count the number of cells, blood cells in the body by estimate, and then you have an idea of what it is, so that you don't take from somebody who does not have enough. So the person has to have a certain amount, a certain quantity. Okay, I think the PCV is supposed to be at least 13 hemoglobin of 13 grams per deciliter, or a PCV of 39,
Greater than
39. Okay, now another thing is that the person must not have donated in the past 3 months. Okay, you can imagine somebody who maybe he's so zealous to donate blood and save people. Out of your zeal, you now there's no traffic accident, you quickly rush there, you go and donate blood, and then the person survives. And then next 2-3 weeks, 1 month, because usually when you donate blood, that portion that has been taken from you, the body builds it back. The body recovers it through some natural processes in the body, but it takes some time. It doesn't happen overnight. Okay, it will take averagely 3 months before what you gave out will be replaced. So it's advisable that once a person gives out blood, he or she would have to wait until at least 3 months before he or she can donate. Okay, then apart from that, people who have certain illnesses cannot donate blood, because we are trying to ensure that even the person who is donating blood is donating a healthy blood. Let you know be that we are donating blood to cure a person, then we cure one problem and then gives the person another problem.
Disease.
You know, for instance, a person who is HIV positive, I mean, you imagine you take blood from a HIV positive individual and then you transfuse it to somebody who is HIV negative. That person would curse you for the rest of his life. He'll tell you probably you should have even allowed him to die in the first place. Okay, so HIV, hepatitis B, hepatitis C, and other infectious diseases around. Okay, we are being careful so that we don't carry from one person to the other. In some cases, even malaria is being screened for before blood is being taken from one person to the other. And a woman who has put to bed, who is breastfeeding, okay, and then a woman who is pregnant. So you can see these are people who do not meet the criteria
for donation.
Then there are other secondary criteria. There are other comorbidities, for instance, diabetes, hypertension, but these are not absolute reasons why someone cannot donate blood. They are relative. Of course, if the person has those other diseases, you would want to look for possibility of other reasons why the person should give or should not give. Okay. So these are some of the criteria. So blood donation has to do with transfer of blood. Okay. If you want to put a transplant of blood from one individual who has enough to another individual
who is in need. Thank you. Okay. So now with this now transferring from an individual who has and is healthy to somebody is in need. Okay. How does this match? I have had people say, okay, they donated blood and there was a reaction. The blood is not, me use our language, the blood is not agreeing. There is boringini. Okay. If the blood is given to someone, donated to somebody.
Yes. So it's just like we said, there are groups of blood, right? And then there's a concept we call blood compatibility. Okay. Now, blood compatibility entails that you are, in as much as you have enough to give, you are also compatible with your recipient. Because there are things, your body produce antibodies which are like soldiers. So once they are not compatible, I mean, these antibodies see this blood like a foreign body, so they fight it, and that is why it is known as a blood reaction. And then these reactions can be acute, they can be chronic, depending on, they can happen immediately, and then they can happen later. Okay, all right. So I mean, for blood donation to be a successful process, there are so many things. In my colleague's definition, he just said storage, but I think you will have to process the blood and then make it suitable before you store, right? Okay. So now, one of the processes he has mentioned in the course of his conversation, in his discussion, one of the processes is that you have to know the blood group. You don't just take blood and then without information. So that is why when you go to a blood donation center, there are forms that you fill. Now this form will have information, your age, your blood group, and then all of that. So, but even as we have such information, we still go ahead to screen, because science is evidence-based. It's evidence-based. Okay. I mean, you don't assume.
Okay, so if I am group O and my spouse is group O and I need blood.
Yes.
My spouse, they can't just bring him and say, okay, both of you are O. Take and donate.
Yes. It is you that know he is O. But we that are transfusing the blood don't know. So we need to confirm your blood group and then his blood group. You might be O, he might be O, but then the rhesus might be different. Okay. So you might have rhesus incompatibility. So you can be O negative while your spouse is O positive. So there will still be a reaction. There will still be the boringini you talked about. So, and then what we are trying to avoid in this whole process is the boringini. And that is why when we are giving transfusion, we take from the donor, we take samples from the donor, we take from the recipient. We try to, in fact, before we give the blood, there's something we do cross-matching. Okay. We call cross-matching. So we go to the lab, we try to cross-match this blood. So what we are looking for is the antigen and antibody reactions that will happen inside the body. We are trying to practicalize it outside the body. So once they are not compatible, that is why we cannot give somebody that is blood group A, we cannot give him O blood group. Somebody, of course, because they have different antigens and different antibodies, and that is already a problem. And then somebody that is blood group B, we can't give him A blood. But there is a concept. There are some things there are people that we call universal donors. Okay. Now, those people that we call universal donors are people who don't have either antibody. Okay. They just have antigens. Sorry, they don't have they are O. Yes. They don't have antigens. Okay. They don't have antibodies, right?
Antigens.
They don't have the antigens. So what happens is that they can give to anybody. Now there are people that we call recipients. they don't have antibodies at all. So no matter the kind of blood you give them, they will not have such reactions. So that is why we need to know all these things. Now, knowing all these things, we first of all, the human body is not a place where you do experiment. So once you are given body, and then there are some reactions that can be lethal. They can be lethal. They can lead to death.
Okay.
Yes. So we try to avoid such in order to avoid such complications. So that is why before we even transfuse the blood, we go to the lab.
Yep.
We do after our basic screenings, we take the blood, we know the blood group of the donor, we know the blood group of the recipient. We try it to see the reaction before in the transfusion table before we now give out the blood.
Okay.
Yes. So in order to have complete safety.
Okay. So yes, we're talking about this blood donation, but there is something I've had people talk about. Okay, maybe I have my patient in any of the hospitals. I have called, there is need for blood. A relative is there, donated his blood, and there are times that you hear people complain that they didn't even give me that blood of that my relative, but we had to buy blood. So how do we reconcile this?
Okay, I would explain this in two facets or in two aspects. One, whether or not they gave that exact blood. Okay, now it doesn't always suffice. Okay, now this is why. If, for instance, I have a patient who is in emergency and needs blood transfusion, and then I donated blood, but the process of either processing the blood, because usually from the time of collection of this blood, it will need to be processed and stored inside certain chemicals so that the integrity of the cells of the blood and the liquid component of it is not lost. Okay, now from the time it will take to process and finish it, from the time it will take to start processing to the time it will take to finish, the patient may already need the blood.
Okay.
Sometimes, due to the because we have known blood groups, we know that this is blood group O, this is blood group A, this is blood group, AB and all of that. Sometimes there are people who would have donated ahead of time, so their own has been processed, kept ready for transfusion. If we have an emergency, we don't want to wait until we start screening. We screen the person that is coming now. We take his blood sample, we process it, we do everything, preserve it before we transfuse.
Okay.
We want to transfuse the one that was there already, life, yeah, that is compatible with the person's, blood disease, to save his life first. And that's why sometimes the very blood you donated may not be the one that will be given verbatim. But of course, you are not the only person who has that blood group. Okay? So we will take out of the ones we have kept from another person who has the same blood group and transfuse to the person in need and save the person's life first. Then your own will not be used for someone else. And the cycle now continues that way. But of course, we know that it is the same blood group that the person needs that is being transfused. Okay? Now, the second question, the other facet of it, where people think that, or people say, we have to pay.
Yeah.
We have to buy.
Let
me just use the word buy.
We had to buy.
We had to buy. Honestly, I have been to some parts of this country where people actually buy blood. But I will tell you of what I know to be the standard practice. In the medical setting, we do not sell blood. However, whatever you pay is 1, for screening, 2, for grouping, for cross-matching, and preserving. Okay? For those who have been to donate blood before, when you look that where they put the needle in your hand and you look at the bag that the blood drains into, you see that there's some liquid substance inside. you would see that there's some whitish liquid inside. That is not just water. That is a preservative. Okay? It has something inside that stops the blood from becoming solid.
Okay.
You know, if blood comes out from your body, it
Yeah,
solidifies.
sure.
Okay? We call it anticoagulant. Okay, so the blood enters into this bag, and then it is preserved there with the anticoagulant. Okay? Whatever money you pay in an ideal setting, it is to cover for all these procedures and not to buy blood.
Okay.
Unfortunately, I have seen that people sell blood. I've been to another part of this state, in fact, not even far away, where somebody was telling me that he came to sell blood. He actually came. He
Okay,
didn't-
his own blood.
Yes, he obviously he had been doing it.
Okay,
So he came.
We'll take a break and we'll pick it from there.
All right.
Maybe it is a market. The economy is making people sell their blood. Okay, yes. So we'll take a break so that when we'll come back, the discussion is actually interesting. You know, so much information in it, and I'm sure you will want to be part of it after the break. So let's take this time out. Yes, I'm so glad that you are keeping faith with us on the program Healthcare live from the Plateau Radio Television Corporation here in Jos. And we've been looking at the issue of blood donation. And I have with me in the studio, by my left is Dr. GIWA Moses Simon. He is a registrar, Department of Anatomic Pathology and Forensic Medicine from the Jos University Teaching Hospital. And by my right is Dr. AYUBA NAMANG JEHU. He is a resident doctor, Department of Anatomic Pathology and Forensic Medicine, Jos University Teaching Hospital, and he is the Public Relations Officer of the Nigerian Medical Association of Plateau State. So this time we will give it out to you so that you can dial the number that will be on the screen, 0906 1910 And you know our rules. Where you call, we would love to know who is calling, where you are calling from, and we appreciate if you move a little bit away from your television set, give us that call, and I'm sure the doctors that are here are ready to do justice to that. So before we get any call coming in, we actually stopped at that commercial aspect of the bloods.
Commercial aspect indeed. Okay. Now the young man is a young man. I think he should be in his either late 20s or early 30s. And he came and greeted us. And we asked if he needed something. He said yes, he is here to sell his blood. And I was like, what? You are here to sell your blood? He said yes. And I asked him, do you have a patient you want to donate to? He said no. He wants to sell it. Okay. And the nurse there, for me, I was visiting, so I had spent just a few weeks there. But the nurse that was on duty with me had been there for some years. She now said, you are surprised? They do it here. They do it. So people come around, on their own, without having any patients, on admission. And then they come around and they want to sell their blood. So they sell it. They collect a token, and deposit their blood there, and then they go. After another 3 or 4 months or thereabout, they come again, make some money, use it to do other things. And it was so surprising to me. Okay. But I will say here that boldly, medically, it is not an encouraged thing. We don't encourage it. We encourage people to try as much as possible to save lives.
Okay.
Try as much as possible to donate for the sake of humanity.
Okay.
For the sake of saving
humanity.
lives.
Okay. Let's see. Okay. The person has dropped the call. Yes, you can call us back. Yes. Okay, so for the sake of humanity,
yes, for
we
the sake
should
of
donate,
humanity,
not for
the sake
the
of
financial aspect
yes,
of
saving
it.
lives. So the money you get asked for is not usually that you donated blood and then you are still buying again. No. Okay. Whatever you give is to process, the blood. Okay. Some of these chemicals are actually expensive. Okay. The anticoagulants, for instance, they are quite expensive. So one will need to preserve it so that it will be given and it's safe for whoever is going to receive it in the long run.
Thank you. Yes, so Dr. GIWA, now this you talked of a universal donor. This which one is the universal donor? Because we've had that word, people use it most often. Universal donor. I'm a universal donor.
Okay. Now, just like we said, universal donors are people who don't have the antigens, right? They neither have the A antigen nor the B antigen. Now, to make it complete, most people, for you to be qualified as a universal donor, you would it must be that you don't have either of the antigens and you don't have the rhesus factor. So in conclusion, when we say a universal donor, we mean somebody that is O negative. That means in the ABO system, you have neither of the antigens. And then the rhesus factor is also absent because either the A or B antigen or the rhesus factor can cause reactions. So in that case, you don't have any of those. So you don't have any antigen that will cause any reaction. That is why you can donate blood to anybody.
Okay. Yes. Thank you. Hello? Yes, who is on the line? Okay. We will appreciate you to call us back. So, okay, still with you now, this issue of this donation, like Dr. AYUBA was trying to say, somebody coming to sell it. Now, by the time you sell that blood, does it go through the necessary screening that you're talking about, that the blood has to be screened, everything to be sure that it is safe for transmission?
Now, the major thing is not even the financial aspect, just like you said, right? It is about the health aspects. Now, what we're interested in is not whether money is involved or not. What we're interested in is giving safe blood. Now, in quote, safe blood. That is a blood that is safe for donation, right? So, regardless of whether the blood is being sold or not, it must have to go through all the processes. Now, let me make a point. I don't think there is somebody that can buy blood. I don't think, right? Because in all honesty, nobody can buy blood. You cannot even buy a human hair. You understand? But this is a connective tissue. This is like life itself. If you can buy life, of course you can buy blood. But I don't think, in all honesty, anybody can buy blood. So let us correct the notion that people have. A lot of wrong information fly on social media. These days, there are a lot of news or informations that are flying around the social media. And then if those notions are not being put in check or corrected, they will continue like that. Now, I want to say with a loud voice to the public that, see, we don't sell blood. We collect money from you to process the blood. Now, remember, when you come, just like he said, there are cases there are emergencies that will come that you don't even have the luxury of time to process all these things, because the processing we're talking about takes time. And then there are patients that will come, and then we call them paper white patients. they are severely anemic. Now, anemia means low blood level, right? So there are patients that will come like that. So in such cases, what we need to do is just to transfuse. So the only thing and then we need to transfuse within the shortest time. Now, the reason why we are giving them within that shortest time is because there are complications that can come with this low blood. There's something they call anemic heart failure.
Okay.
The heart can fail. So in those kind of cases, we don't even wait. Remember also, there are sickle cell disease patients. There are road traffic accident patients. And then these are patients that will come with urgency. In these cases, remember, we don't have the luxury of time to process this blood. So the blood that we collect from you in the name of that you think you sell, we store it for such cases. Remember, when you are in your hospital settings, you prepare for anything. So these are the things that we do with these bloods when we keep them. Now, how much can you buy a cell of blood? You know, when you try to look at all of that, you realize that, I mean, you cannot buy, and then this blood carry oxygen, and then, can you buy oxygen? You know what I mean? So these are things that we put in place, that we need to, that the media needs to know, and then the public will have to know.
Okay.
So we don't sell, I don't think we sell blood.
Okay, thank you. So now with this thorough screening and everything to be sure that you're not inflicting, injury on the recipient, where can we get these bloods that we are sure that, okay, if I should get blood from this place, I'm sure that it must have gone through the necessary screening before it is being transfused?
Okay. Ideally, there should be a blood bank in maybe every local government, and if possible, every
hospital,
yes, or every PHCs. Unfortunately, that cannot suffice. Okay, but we are aware that there are places in Plateau State. Okay, we have the National Blood Transfusion Center in Plateau State Specialist Hospital. Okay, it's a whole place dedicated for the purpose of blood transfusion. Funny enough, it is not only blood in terms of red blood cells that we're talking about.
Okay.
That we find in such kind of a place. We have what we call red blood cell concentrate. Okay. Remember earlier in the introduction, we said that the blood has the red blood cells, the white blood cell, and then the
platelets.
The platelets. Okay. Now in the blood transfusion center, that's the National Blood Bank. What happens is that this blood is collected and then it is segregated into different elements. Okay, the red blood cells are packed in one place, so they call it red blood cell pack or pack red cells. Okay, then we have plasma. Okay, plasma is that part of the blood cell that contains other cells, so we call it fresh frozen plasma. So it's taken and then it is frozen and becomes ice under certain controlled temperatures. Then we have what we call cryoprecipitate. Okay, so you can see that in those places there are people, I will tell you that there are people who need blood, but not the kind of blood that we put in the bag and you see red blood. They need a different kind of blood. Okay, so you give them that type of blood that they need. Okay, that component that is needed in their body, that is deficient in their body. For instance, people that have bleeding tendencies. Okay, for instance, let's assume we have, the other day we were talking about Ebola and the rest of them. Let's suppose we have somebody with Ebola virus and then he starts to bleed. It means the components of blood in his body that is supposed to stop him from bleeding has been exhausted by the disease. So you would want to replace. So it is in such kind of patients you get that very component and transfuse them. Okay, because some of them, their lifespan is very little. From the time you take them to the time you transfuse, some of them would have died. That's in the ordinary process of transfusion that we have. But in this way of segregation, they are stored in controlled temperatures. They don't lose their viability. They still function once they are transfused back into the patient's body. So we have a place here in Jos Plateau Specialist Hospital. In Jute, we have a place. Jankwanu, okay, Ola, all these places are places where they may not have as big a place as we have in Plateau Specialists, but of course they do. And I'm aware that even in our local governments, our general hospitals, they have places where they store blood, okay, in good quantities. Now the question is, despite having those places, do we have enough donors? That is why we are here. Okay, we are here to spur people, to encourage people to donate. Okay, there are people who are healthy, who have the blood. Some even have what we call polycythemia. The blood is even in excess in their body. Yet, there are people who are in need. Sometimes some people would even die because of anemia. He mentioned some instances, sickle cell anemia, road traffic accident. One of the most common ones, which should not even be happening, is postpartum hemorrhage, where women die after childbirth or following childbirth from anemia. These are preventable, causes of death. So as much as possible, okay, we are here to encourage people. Do not refuse to give because you think your blood is being sold out. If you refuse to give and you say that I will give them, they will sell it and make money.
Yes.
Well, me, I've been in the clinical practice for a number of years now, and I cannot remember any time where I got any money that was from the sale of blood of anybody. Sincerely speaking, so it's a misconception, okay, that should be corrected. Okay, so we have places where you can donate blood. See, even if you are not sure where, you could go to any facility and ask. You'll be guided. Okay, I want to donate blood. I want to save a life. You remember the other time when we had the attack in Angwan Kuba,
Yes,
where we had almost 40 people that died. That very night, there were people in Jute that needed blood transfusion. The whole store of blood was exhausted. Okay, just picture in your mind that maybe we have had people that donated so much blood before that time. Just maybe some people would have survived that night. Okay, and then there are many other instances. Sometimes if you are reluctant to give, maybe that very blood you are reluctant to give, maybe they want to save. There are people who, for instance, people who are O negative, they will receive from only somebody who is O negative because their blood group is peculiar to them. So imagine you are the only O negative people around, and then you refuse to go and donate because you feel I'm healthy now. Okay, there might be somebody who is in need of your help, who you may be the only person who can save, because somebody in O positive group cannot save the person. Somebody in A or B cannot save the person. It is now you. So you, the savior, now has refused to come through for such an individual. So you can see why it is important that people learn to donate. You don't have to do it every day. You don't have to do it every year, but at least from time to time you can decide, okay, I think I should give out to someone. Okay, it may end up being your wife that will be in need of blood now, or maybe your brother who just have a road traffic accident. Maybe before they even call you, they are rushing to the hospital. So you can see how this thing works. It's a cascade. Okay.
So now he's advocating we should float, the blood banks with blood because of any emergency. So now, if you have enough of the blood and you feel you are healthy and you do not donate it, is there any effect to you who looks at yourself as the healthy person?
Just like you said, having more than enough blood is even a condition. It's a condition called polycythemia. Now, it can be a bad condition. Now, sometimes giving blood, it's not only advantageous to the person receiving, it is advantageous to you as a donor.
Therapeutic.
It is therapeutic. Let me use the right word. It is therapeutic to you as a donor, because in a case where there are people who have high surge of hormones, that encourage production of blood by the bone marrow. For instance, there are people that have there is this hormone that we call erythropoietin, right? So there are people that have enough of that, and then they keep on producing red blood cells. And remember, I know we didn't mention that red blood cells have a lifespan.
Okay.
All these blood cells that we are talking about, they have a lifespan. For instance, the red blood cells, they have a lifespan of about 120 days. So after 120 days, either ways, these cells will die. They will find a way to kill themselves. Do you understand? They reach their old age, or what we call in science, in pathology, we call them senescence. Okay, so the cells reach where they can no longer continue the journey of being red cells. So they find a way to kill themselves.
Okay.
So giving out this blood encourages the places or the bone marrow to produce new blood cells. Do you understand?
Yeah.
So you have viable and new red blood cells being produced. Now another thing, that is therapeutic.
Okay.
Of course.
Okay.
And then just like for people that have excess in polycythemia, there is a condition that is called polycythemia rubra vera. It can be lethal. So, but people that have such conditions, if they give out blood continuously, it tends to reduce the level of damage that will be done.
That is in fact the only known cure.
Yes, continuous
for
blood
people
donation
who have the condition known as the polycythemia. The
Yes.
only known cure
is
to give
is
giving out blood.
phlebate. If you give out, you keep donating.
Yes,
Because when the blood is in excess, it puts you at risk of many other things, including stroke.
yes.
Okay.
You can imagine somebody having stroke just because he
He has
enough
excess
blood.
blood. I mean,
So how will one know that he has enough? Is it by going to donate or
Yes, usually, commonly, they are discovered accidentally.
okay.
yes.
Most times it is incidental that people find. Maybe he just went for routine test and then this blood is too much now. Okay, let's repeat again. Maybe they even repeat in different places and say that it's quite high.
Okay.
Okay, that's when it is now diagnosed. But most times it may not be obvious that
Yes.
this is a problem.
Because they live healthy lives.
Okay.
They live healthy lives. They live normal lives. But remember, I think we didn't mention also that this blood have a particular range. So
Okay.
if
Okay, very brief.
okay, if
Yeah.
they go outside that, if they go above the upper limit of normal, that is when we say they have polycythemia.
Okay.
Yes.
Thank you.
And then they have to give in
Give.
order to come back
Give.
to the level.
Give.
of blood.
Okay.
Yeah.
Finally, what will you leave us with very briefly?
Okay. I will leave everybody with what I used to leave everybody with. And that is that Nigeria is not healthy. As much as it depends on you, try and stay healthy. As much as it depends on you. Whatever it is you have to do to stay healthy, please do it.
Okay.
Thank you and have a good evening.
Thank you. Yes, and one of the ways of staying healthy is go and donate. The moment you are within that age, donate so that it will save a life. You might not even know, it might be you one day that you will be in need of blood, and if nobody gives, where do you get it from? And don't shy away that no, I will not give my blood. After all, they do sell it. After all, they took from my brother, from my sister, and they sold it. They've explained everything. The bottom line is that make sure you donate blood to save a life. So that is what our guests in the house have been able to leave us with. And so on that note, I sincerely want to appreciate Dr. AYUBA NAMANG JEHU, who is a resident doctor, Department of Anatomic Pathology and Forensic Medicine with the Jos University Teaching Hospital, and also the Public Relations Officer of the Nigerian Medical Association Plateau. We are indeed grateful.
Thank you, man.
Yes.
Thank you for having me.
Thank you. And Dr. GIWA Moses Simon, he is a registrar, Department of Anatomic Pathology and Forensic Medicine, Jos University Teaching Hospital. We're truly very grateful.
Thank you very much.
Yes. And to all of you, thank you. Those of you that attempted to call, but eventually we couldn't get any of your calls today. let's keep a date next week as we'll come your way again with another package, God's willing. So on behalf of the entire production crew, it's yours sincerely, Rebecca Jot, saying goodbye and God bless.